Hello everyone. So today we'll be discussing about a new drug, Brensocatib, which is a drug involving and being studied in bronchiectasis. So bronchiectasis is a chronic progressive inflammatory lung disease with a wide range of clinical manifestation and diverse etiology. But when coming to the pathophysiology, the main central part causing bronchiectasis is neutrophil mediated inflammation. So basically, these neutrophil serine proteases, their excess release is the major cause or major thing that leads to chronic airway inflammation. They themselves are just precursor, but when they are released from the bone marrow, they are being converted into functional enzymes with the help of dipeptidyl peptidase 1. And this drug basically it is a oral selective competitive and reversible inhibitor of dipeptidyl peptidase 1. So when this particular dipeptidyl peptidase 1 DPP1 is inhibited, so these neutrophil serine protease precursors they are being not converted into functional enzymes and hence breaking that vicious vortex which is leading to bronchiectasis. And in many studies, it has been seen that elevated levels of neutrophil serine proteases in the sputum of bronchiectasis patient are an indirect marker of severe disease, increased risk of exacerbation, and more rapid decline of lung function. So giving this drug basically inhibits this neutrophil mediated inflammation in bronchiectasis and hence decreases the risk of exacerbation and disease progression. Whatever the prior treatment available in the market, what we are giving as per the guidelines, basically they do not adequately address the inflammation or slow the progression of bronchiectasis also. So one of the trial which we'll discuss here is this ASPEN trial or the ASPEN study, which is a phase 3 trial of DPP1 inhibitor named Brensocatib in bronchiectasis. Prior to this, there was a phase 2 trial also, which is Willow trial, which studied the same drug, same doses, and around for 24 weeks. And that also showed prolongation of time to first exacerbation and lower rate of exacerbation as compared to placebo. So, in a summarizing way, so brensocatib is basically indicated for non-cystic fibrosis bronchiectasis. The main mechanism is reversible inhibitor of DPP1 targeting neutrophil serine proteases, which is the main mediator of neutrophilic inflammation. Available in oral dosage of 10 mg and 25 mg given in OD dosing. The two main trial are the ASPEN, which we'll discuss here, and the Willow, which is phase 2 trial. Both of them showed a decrease in the annualized rate of lung exacerbation, and the decline in FEV was less with the 25 mg of dose when compared with placebo. So coming to the ASPEN trial, this is a phase 3 double-blind multinational RCT. It enrolled around 1680 adults and 41 adolescents with bronchiectasis and exacerbation, which led to antibiotic treatment in the prior year. So they were randomized into 3 arms. So for adult, it was 1:1:1, and the doses, one arm was given 10 mg of brensocatib, one arm was given 25 mg, and third arm was given placebo. For adolescent, the division was like 2:2:1. So what were the primary efficacy endpoint that was studied? So primary efficacy endpoint was the annualized rate of pulmonary exacerbation, which was comparatively lower when compared to placebo in with both 10 mg and 25 mg. With 10 mg, it was 1.02, and with 25 mg, it was 1.04. Whereas with placebo, the number of exacerbation events in a year was 1.29. Coming to the secondary efficacy endpoint, so time to the first exacerbation over a 52-week treatment period. So both 10 mg and 25 mg doses, they had a larger time to first exacerbation as seen by hazard ratio of 0.81 in 10 mg and 0.83 in 25 mg. Overall adverse event across all the three arms were almost similar. Adverse events leading to the treatment discontinuation was also similar in all the three arms. So that was all about Brensocatib. So Brensocatib is one of the new oral DPP-1 inhibitor, which basically targeting neutrophil serine proteases and thus reducing the bronchiectasis exacerbation, and it decreases the rate of decline of FEV1 actually. Thank you all, and if you like the content, please share and subscribe to channel.